Now, in 4 days' time, the government will roll out a new public medical insurance scheme geared towards making the universal health coverage program a reality. But as the government accelerates towards the date of 1st of October 2024, there are weighty questions as to just how prepared the Ministry of Health is. Tonight, we walk through some of the challenges the Social Health Authority faces in the face of insurance premiums that will leave salaried Kenyans ripped off sizable chunks of their salaries for benefits that by no standard match the political promise given more than a year ago. We begin with a review of some of the packages that you should expect starting Tuesday next week.
When the National Hospital Insurance Fund, NHIF, ceases to exist and a new entity takes over on the 1st of October, contributors currently paying between 500 shillings and 1,700 shillings per month will face new pinching realities. With the new Social Health Insurance Fund, Kenyans will be required to pay 2.75% of their income from the employed monthly, and for those in the informal sector, they will make an annual payment in one installment. For the salaried, a person earning 20,000 shillings per month will now pay 6,600 shillings per year. For one earning 100,000 shillings per month, the contribution rises from 1,700 shillings to 2,700 shillings per month. And there is no cap, meaning for a person who earns 500,000 shillings monthly, they will pay 13,750 shillings every month, translating to 165,000 shillings a year. Top corporate executives who make up to 10 million shillings per month, the shift deduction will be 275,000 shillings monthly or 3.3 million shillings every year. On the other side of services, every SHA member, regardless of their income, will be entitled to a primary healthcare package of up to 900 shillings per year. This is the amount that will finance primary care consultations, laboratory investigations, as well as prescriptions. For optical care, each family will be entitled to a limit of 1,000 shillings per year, regardless of their contributions. For dental, a maximum of 2,000 shillings awaits each family, though it won't be available until there is a budgetary allocation. For cancer screening, even though there are rates scheduled, cancer-specific screening will not be available immediately. And for persons who need to monitor their sugar control, usually required every 3 months, a HbA1c test will be financed at 1,000 shillings, but once a year. For kidney patients who need to monitor their creatinine levels, the SHA package will finance 300 shillings, but once a year. And for cholesterol monitoring in patients who are at risk of cardiovascular diseases, that will be financed at 300 shillings, but again, once a year. Patients requiring hospital admissions in level 4, 5 and 6 hospitals will benefit from a payment of between 3,360 shillings and 4,480 shillings per day, a reduction from the packages that were subjected to public participation earlier in the year at the maximum rate of 5,000 shillings per day. Every family will be entitled to a maximum of 180 days of hospitalization every year. This means that the highest amount of inpatient cover by shift would be just over 806,000 shillings per family, regardless of the amount contributed. Patients requiring overseas care will now benefit from a 500,000 shilling limit per person per year, as long as they seek services at SHA empaneled healthcare providers abroad.